So depending upon where you work and sort of your clinical setting, right, that would dictate sort of where you start with your clinical standards or guidelines. A wide sort of variety of clinicians use these devices, but probably primarily in the perioperative and procedural areas. And so for that area, we would start with the ARN guidelines, particularly that for sterile technique, which have a large swath of literature review that is contained within that particular guideline, talking about the correlation of poor air quality, right, with the reductions that could be seen with SSIs when we actually improve upon that. So I would start there, and the ARN guidelines have done a nice job at talking about, using this as a strategy to reduce airborne contamination, having a formal program that's interdisciplinary, that we're bringing all the different stakeholders together, that we look at air quality management as a correlating factor to SSI risk. And I think that's an important perspective for all of our accrediting bodies, whether it's DNV, Joint Commission, AAAHC, or others, right, to talk about continuous quality improvement. From an ASHRAE perspective, we know that temperature, relative humidity, door openings, those are important components. You've also got the ICRA standards that go back to the construction conversation that we've had as well, right? To really make sure that we're preparing ourselves for total success when we're doing construction or renovation, both from a patient provider as well as the community perspective. And I think lastly is from an occupational health component, we have to look at OSHA, right? And there's the OSHA PPE standards, the OSHA respiratory protection standards, and the OSHA environmental and respiratory contaminant standards. And so these are all areas that are really critical for us to understand from a healthcare leadership component. These help us keep our patients safe, but they also help us keep our healthcare workers that are delivering world-class care in our facility safe as well.